Welcome to the sixth episode of the Pre-Health Purple Hawk podcast, brought to you by Pre-Health Advising at Hunter College. My name is Isaiah Keynes, and it is a pleasure to welcome Macaulay Honors alum and NYU Grossman School of Medicine graduate, Marie Mazzeo Weaver. Marie is currently a preliminary medicine intern at Mount Sinai Morningside/West and will soon specialize in physical medicine and rehabilitation at Rutgers/Kessler. She graduated summa cum laude from Macaulay Honors College at Hunter College in 2014, majoring in biochemistry and earning a certificate in public policy. Marie also attended both Hunter and NYU with her twin brother Michael, who we interviewed in the previous episode. Welcome to the podcast, Marie.
Happy to be here.
Yes. So I guess we'll get started right away. First question, I asked this to everyone. I assume you've heard this through multiple med school interviews, residency interviews, all that good stuff. What inspired you to pursue a career in medicine?
The classic question. I think as I'm starting my transition to residency, it's like a great time to reflect. Also, lots of moving going on now. So I've rediscovered some like old yearbooks and things from like fifth grade. And on there, I'd said that I'd wanted to be a doctor. And I think back then I had obviously no idea what that meant. I know doctors in the family, but my mom was a nurse my entire life, and so growing up, I always looked at the way that she helped like patients and eventually her students. She was a school nurse, and I was really inspired to pursue a career in medicine. As a big part through her. I've always been really passionate about science and facts and knowledge. I've really also been really passionate about education for a really big part of my life. I've always been like the first person to like tutor and like participate in like just even the school process of learning. And so when I was thinking about what I'd want to be when I grew up, doctor seemed like a really natural choice because it's the perfect opportunity to help people, to practice science, to participate in education, which is a big part of medicine. I think a lot of people forget about, but if your doctor's not teaching you something, I think they're missing out on some really good quality healthcare. And then growing up, my dad would always say that he wished that he was in school forever. And so I had that in my mind, like, oh, I'm going to stay in school as long as I can. And being a doctor sounds like a good idea. Over the years, that answer obviously changed. But service to the community, education, and just like my love of science really has remained a constant. I really love just having the privilege to be able to help people by using just like all the fun tools that medicine has, and that includes the social stuff as well as facts and knowledge I can get from papers. So yeah, a little bit of a long-winded answer, but I think my reason for why medicine has really changed over time and developed over time, but really based in just like my core values and the things that I wanted to accomplish in my life.
No, yeah, that's an amazing response. I mean, I can totally see how like being a doctor is perfect if you want to stay longer in education, but also be able to educate others. I also have seen that like education amongst in the medical field is definitely underappreciated and isn't really talked about a lot. So I mean, that's genuinely a really nice reason to pursue a career in medicine. So yeah. Um, so yeah, even going more into the education part of it, I'm assuming undergrad was definitely a big part of it, your pre-medical career. So how was your journey applying to medical school? I know it's a very daunting process. It's a stressful process. So I mean, you've made it successfully. You got into NYU, so everyone's gonna be watching this, everyone's gonna be clicking on this video just to see that.
Oh,
So I guess we'll answer the big question here. How was your journey applying to medical school? And do you have any tips for current pre-medical students?
absolutely. I think really something like this, it takes a village. And so I would not be where I am if not for the support of like my friends, my family, and just I like at Hunter, especially the pre-health department, specifically Camille was an incredible resource. I was also a member of the Macaulay Honors College, and the advising there, the director, my advisors, just the other like people in the program, they were all tremendous sources of support for me. During my first 2 years at Hunter, I had actually like maybe I don't want to be a doctor. I don't know if I want to stick in that long, like go and be in school that long. I had these ideas about like what it meant to like if you have a future family and what that meant for a career in medicine. And so, I was really nervous about it at first. And so I thought, maybe I'll do law, maybe I'll do physical therapy. But after playing around with like different careers, I really stuck with medicine. I did come in taking pre-health classes, so it didn't delay my graduation in any way. But yeah, I guess some of my biggest advice is use your supports, use the pre-health office, talk to your advisors, make sure you've got like the classes that you need. Make friends with upperclassmen, make friends with people who are also in your age group, to find out like what kind of cool things are they doing. Just having friends along the journey is such a big and I think understated part of it. I also obviously my twin brother was also thinking about going into medicine, and so he was a tremendous support for me as well. And I think just like really following your passions, like don't do something just for the sake of it, because when you're on an interview and talking about like the things that you're passionate about or why you want to do medicine or what brought you like the activities that you pursue in college, you really they want to see that passion, and they passion's a really hard thing to fake. And so, finding activities like even if they're not totally medical, like, being a scribe, which is awesome. And some people really enjoy it. I never was like, oh, I don't really want to do that. But I taught peer health exchange for most of my undergraduate experience, like working in high schools and teaching skills based health ed and mental health care to high school students in the public school system, which I was a product of as well. So yeah, just really like follow your passions, make sure you use your supports, lean on those supports, and you know try and maintain a as healthy of a life as you can while you're juggling all the craziness of pre-med. I think is really important, and something that I wish that I had taken a little bit more like care of my mental health at that time. Like I felt like I was really focused on getting the top grades that I possibly can and doing all the things and all the research and getting all this stuff done. Um, but I think, like, as I went through this journey, especially, like, going through med school, just, like, really taking time to take care of yourself, hang out with your friends, and I did find time for that because my support system would be like, "Alright, let's go. We're hanging out, we're going out, we're gonna do some fun stuff." But, yeah, I think just those are kind of the main things. Friends, use your advisors, use your academic supports, use your social supports, and, just try and have a balance is the key.
Yeah, thank you for these amazing tips. I mean, personally, also as a pre-med student, as a freshman, I think I also sometimes felt to also try to spend more time on myself, my mental health as well, and hanging out with friends and such. It's all all of us are trying to maintain a 4.0 GPA or trying to get all the A pluses and all these hard classes, but we also need to worry about us as well in the process. Yeah, you
You
don't want
can't
to
do
sing all the
yeah,
time.
you
Yeah.
You can't do everything, and I think, one of the things that I learned was just, like, start to taper up the activities that you're doing, right? Like, don't start and join a million things at once in college and then try and balance the adjustment. It's better to add one activity at a time, like, really invest yourself in that thing, and then when you feel like you've got the emotional, mental bandwidth to expand, make it something you're passionate about and add that on as well. I like for example, I've always loved softball. I've always like I grew up playing sports and I was on the Hunter College softball team. And after playing the full season on the like the first season, first year, I realized that I wouldn't be able to maintain personally, couldn't maintain doing that with the other things that I wanted to accomplish in college as well. And at first I was like, oh, I'm a failure because I couldn't be able to like accomplish this and stay on the team and do this. But I finished out that season. I was like, look, you're not a failure for readdressing your priorities, right? Some people even say like, maybe they start pre-med and then they want to switch or they do something else. Like it's your life, right? Like you should be able to do the things that make you happy, that bring you joy. I still played softball and I did that on the side. And I actually just recently joined my residency has a softball team. And so yeah, it's just like I think being it's okay to reassess your priorities. It's okay to drop some things, and as long as you fulfill your responsibilities. It's better to take on less and be really involved and really to like show make it your passion project than to be taking on everything under the sun.
Right. All amazing tips. Definitely need to take that because I'm kind of that type of student to try to do everything, kind of
Yeah.
check all the boxes as early as possible. Yeah.
Yeah, and there's some boxes that you're gonna have to check, right? Like we know like that there's a little bit of a formula to making sure your med school resume is a little bit padded, but you don't do your shadowing hours, do that kind of stuff, but it doesn't need to be the entire time, like every single year you're in the hospital because that's what med school's for, like, once you're in med school, but, Camille will talk to you about how many hours are appropriate, in the hospital. Obviously, COVID changed things, and so the applications coming up are gonna be crazy, but, I think really what med school interviewers are looking for and what residencies are looking for is just, like, you've got a really clear, defined passion, and you can having the grades and stuff gets you in the door, but the way you get accepted is just like people really seeing that. It's like, is this someone that I want to work with? Is this someone that I could see being a great doctor one day?
Wow. All right. Thank you so much for these tips. I kind of want to echo on something you said earlier. You said that Hunter was a really big role in like helping you get to where you are today. So I want to really talk about like how was your time at Hunter? How was your time as an undergrad specifically, overall as a pre-medical student?
Yeah. Yeah, Hunters just like was such an important part of like my life, my journey. And I said like I don't think I would be like at NYU med school graduating and doing all this stuff if it wasn't for Hunter. I probably would have like stopped and done something else, but like, all right, forget pre-med, this is crazy. But I really, yeah, had a lot of support from like Camille and Lev, the director, Macaulay. I invited them to all the biggest events in my life, including like match day and graduation, and like they were just so important in that process. And I really want to make it very clear to them that like I know I wouldn't be here if it wasn't for them. Um, and yeah, I think Hunter was really great. Like I was able to find a wonderful community in both like with my friends who weren't in the Macaulay program, my friends that were in the Macaulay program, um, my friends on the softball team, like just like in so many different clubs, like Peer Health Exchange. I just met so many people and made so many different communities that I just felt like so supported. And I felt like the research I participated in was like, it ended up being fun because the group was good. Like my mentor was fun and nice. Dr. Kleiman was really supportive. And I really just I think surrounding yourself with good people and finding good mentors are it's the key. I think people are awesome,
Yeah.
like being around people introverted, but finding your people and people who support you and like make you feel like you're like meant to do great things and support you along the way is really the key. And so I feel like I really found that in Hunter through specifically pre-health department at Macaulay, the research lab I was a part of, peer health exchange, and just like teachers. So Dr. Alai, the intro bio and other bio class instructor, she is also another person I credit immensely for my success because I went to New York City public school and I went to New York High School, which go Utes. But I felt like when I came into college, I was like, oh my God, this is not like this is way harder than I had ever anticipated. I felt like I never had to think that way before. And I think the rudest awakening for me was intro bio. So I scored like a 60% on the first multiple choice, and I was like, "My life is over. There's no way I'm gonna be a doctor. I'm not smart enough for this." And it was, I'm laughing about it now, but it was just like it was devastating at the time. I was like, "Okay, well, I seriously need to make some changes." And so yeah, I mean, studied. I looked to my brother because he did really well in the first. Because I was like, "How did you do this? How are you thinking about this stuff?" And I really learned that the best way for me to learn was working in groups and teaching others and learning from other people, doing questions and like write. So I would write questions for my friends, they would write questions for me, and we'd have these like massive study groups. And I ended up actually having Dr. Light ended up telling me this later that I ended up having the highest grades in the class by the end of the year with a 60 on the first multiple choice section. And I mean, that was crazy. I didn't expect that, but I really overhauled that I studied. It's just like having the courage to kind of change everything that you're doing when something's not working is really tough. You're like, okay, well, this worked for me throughout high school, but it doesn't necessarily mean it's going to work in college. And so, and yeah, in med school, I changed the way that I studied too a little bit. And like, I think like life is such a process, and you really gonna have to go with the waves, go with the flow, and just kind of adjust when you need to. But it's hard to kind of overhaul all that stuff. So I definitely know what it's like to struggle on the intro bio tests. But I think like after learning how to study better and kind of getting into the flow of studying, the schoolwork ended up being like a lot easier. There's certain subjects where I definitely struggled. Like I've never been that great at math. Math is never my thing. So physics was a nightmare for me. But I did squeak out to doing okay in that class somehow. But um, yeah, I think the biggest part of that was just having like really awesome friends that I studied with in the library and so many like late nights, but also sleeping well.
Mm.
I only pulled one all-nighter in college,
Wow.
and, it was like finishing an Orgo lab report, and I promised myself I would never do that again. I was, like, crying in the middle of the day. I was like, "Okay, this is not working out very well for me." But yeah, sleep is really important, and as I've learned in medicine, just, like, how important sleep is, I'm glad that was a strategy I adopted really early. Just, like, getting adequate sleep at night and setting up good sleep habits.
I need you to give me your sleep magic because I don't know if it's possible for me to not pull an all-nighter with with the
It's a
especially
lot of planning,
before.
pre-planning. Yeah,
Yeah.
just, like, knowing when the assignments are coming up, like, getting an early start on them, so you know, supporting your friends, like, everyone supporting each other just makes things, like, work teamwork makes the dream work, you know? Like, if you're having trouble on a problem, seek out help, go to office hours, and then you could look up, like, sleep hygiene techniques, and that's the medical term for it, and they'll say things like, "Don't do work in bed," which is, like, when you're in college, like, the number one place anyone's doing anything. But yeah, just like finding and really separating the work and your room from work and setting up a nightly routine and stuff. But yeah, you can look more into that later.
So yeah, I mean, thank you for all of these tips. I mean, support systems definitely are really big. It seems like we're really big in your journey, and it seems like we had very similar experiences in Bio 100s with the first exam. So yeah, but I mean, that's really great to see that Dr. Ali, an intro to biology teacher, a teacher that you took your first year, was such a really big impact. So I
Yeah.
think yeah, I mean, that's honestly like really great to hear how big of an impact someone that you took freshman year can have on your medical careers. Yeah.
Absolutely, and, I really remained pretty involved in the bio department throughout med school. I mean, sorry, throughout undergrad, actually even a little bit in med school, where I was a recitation instructor. My brother and I started, like, this peer tutoring program, and then during my gap year, I even came back and taught, like, what did I teach? Yeah, biology recitation, and then during my research year in med school, I came back and I taught, like, bio lab, like, intro bio lab. So, um, I definitely, like, just still so passionate about, like, biology. Obviously, it's just, like, goes along with medicine, but more so it's just, like, teaching students and showing them, like, "Hey, like, this stuff is really tough, but it's not about memorization, it's about, like, understanding processes and, like, just teaching people how to learn," is something that I really love doing.
And I mean, that's also something I've started to notice taking all of these really hard classes is that like memorization, is one aspect to it, but understanding it can definitely get you far. So, I mean, yeah, I mean, that's something I think is overlooked a lot. So thank you for bringing that to light. Yeah.
Yeah, I think it's one of the key things that, like, once you kind of figure that out. Orgo is one of those classes I think for a lot of pre-med students where that really kind of hits them in the face. They're like, oh yeah, if I memorize things, it's not really gonna work out. I have to, like, understand how the electrons are moving and how to draw these arrows and why things are moving that way. And then all of a sudden it becomes a lot easier. It's like solving Sudoku puzzles or something. Like, I don't know. Yeah, just it becomes more of a process and less of a rote memorization of this becomes this, and then that'll carry with you throughout medical school. I think
100.
that's why they make you take all these classes. Like, some of it's like, yeah, there's, like, a basis of, like, good to under things kinda come up too, and you're like, "Oh, I remember, like, phosphofructokinase deficiency I saw in the clinic once," and I was like, "Wow," really throw it back,
Yeah,
to
throwback.
intro bio there, but yeah, but I really think it's, like, just the way you learn and the way you think is t that's what these classes are trying to teach you, and that's what I try and teach my students when I was a bio, like, instructor. I was like, "These multiple choice questions, like, people know the content," and, like, I did. Like, I knew the content, and I still struggled on the questions. It's really about, like, dissecting the information, like, picking out what's important, like, do process of elimination. Like, you're reading each answer choice with intention. Like, okay, does this answer the question that is trying to is there something wrong here? And I think that really carries over into the clinic and, like, working with patients because there's gonna be a lot of details in those stories. Like, patients don't know what's important. It's important, but the important job for you is part of it is asking the right questions and then figuring out what's important and just, like, building this differential and holding all these ideas in your head. I think these classes do a really roundabout but weird way of preparing you to do that.
No, no, definitely. Those multiple choice questions where one word is different between the four answer
Yeah, but
choices.
it's that nuance that, like, that's where, like, where everything is in medicine is really in the nuance because things are, patients, they're not textbooks. Like, everyone's presentation of things are so different, and so, like, really understanding nuances, it's, like, that's the heart. That's where the complication stuff is, yeah.
So that's good to know. We're getting prepared for med school
Yeah,
through this. Yes.
yeah, you're right.
Um,
And also all the writing, like, one of the things that I did a certificate in public policy you mentioned before, and one of the greatest things about that was just, like, learning how to, like, like, not only tell a story, but, like, write, like, clearly, efficiently, and technically in some ways, and that really kinda came across so much in med school, and, like, being a doctor, which I am now, which is weird, it's like, I'm a doctor, that's crazy, but, you have to write a lot. Like, there's so much writing in medicine because there's so much storytelling in medicine. Like the patient, it's you and the patient, and then you kind of dissect the story, digest it, and make the conclusions that you can, and then put it in the medical record so that you're constantly revisiting and like coming up with solutions and it's wild. So yeah, there's so much storytelling and dissecting, and that's why the cars, which is the bane of everyone's existence on the MCAT. I'm like, this is really important because you have to really have a command, and like the way that you write is also important too because it could be perceived in so many ways.
Right.
Yeah,
Uh,
it's important for other healthcare providers. Yeah.
I actually wanted to ask a side question about that, about the certificate in public policy and more about the humanities side of medicine. Like how was that support? And you kind of answered this already. How did that help you in your medical career? Like taking on public policy classes, that were kind of like writing based versus like STEM based. How did that help you? And you kind of answered that, but if you want to expand more on that, yeah.
Yeah, I'd love to. So I think one of the important things is like they say the term well-rounded is thrown out so much, but I think like in medicine is so important to be like as well-rounded as possible. And like taking humanities classes really does like open your eyes to so many things. And there were so many classes. The certificate in public policy is such an amazing thing to do at Hunter. And one of the things that I totally recommend to everybody, or at least doing they have certificates in human rights, like pretty much doing anything at the Roosevelt House. um it's just such a great experience because there's so much to medicine that's just not science. And I talked about some of those things before, like just like the storytelling and giving aspects of medicine. But um, yeah, technical writing is important because you see like doctors doing rounds on TV shows, and like rounding is, like you're really condensing everything and just bringing up the important parts and like making a plan. But I feel like the humanities classes that I took some really, really interesting classes, like things like Latino communities in the United States. And then there was a narrative medicine class I took, and just like really like it just opened my eyes to just like I don't want to say the human part of medicine because I think that humanistic medicine is the core of medicine, and like I think that's the place we should be starting. But yeah, just really understanding a person's story goes so far beyond like the list of symptoms that they have. And taking classes in the humanities really just opens your eyes to like the lives of so many people that are so different from you. Like reading like authors that their backgrounds are totally different from you, and just like, getting exposure to different communities, different religions, different even like policy stuff, right? Like policy is such a huge part of medicine, and it affects our patients every day, like insurance coverages, things like the Americans with Disabilities Act. These like having good understanding, or even just a minimal understanding coming in, like to be a proper advocate for your patients, you need to have some understanding of the crazy hoops that they're jumping through, just to navigate their daily lives. And that's why I'm so grateful for like having social workers who have way better understandings of these things than we do, and like working really closely with colleagues in other specialties. It's just like it's unbelievable how much stuff goes on when someone is ill. Like just like how many things in their life change, how work is affected, how life is affected, getting groceries, and um, I just think like humanities are such an important part of medicine and such an important part of medical training that like not pursuing that and just doing like the bare minimum, it's just like it's just not enough. And also, it's a nice break, right? Like doing just science all the time is so exhausting, and like I feel like it stimulates such a different part of your brain and makes you think differently, and it's just like I'm a huge proponent of indulging in the humanities classes.
So yeah, that was going to be my next question. Is I'm assuming you're going to give the tip of try to take humanities classes as well. They are also
Yeah.
as the STEM classes.
Absolutely, and, Hunter has a language requirement, which people are like, "Oh my god, why do I need to take a language?" Oh my god, it's so important, it's so helpful. It's so helpful to have even just basic skills in another language. Like, I consider myself an intermediate Spanish speaker. I took, like, Spanish in, like, middle school, and I took Spanish at Hunter, and I did, like, a Argentina study abroad trip, which was super awesome, and totally recommend that, for their winter semester as, like, a language immersion, and then I did some medical Spanish stuff in med school, and I will like I'm not certified in Spanish, so I will never do like a patient encounter fully in Spanish, but you'll never believe just the amount of rapport that's set up by in Spanish, introducing myself to the patient, saying, "Hey, I'm going to call an interpreter because I don't feel comfortable having this conversation in Spanish." And they're like, "Oh no, that's fine. You're so great at Spanish." I'm like, "No, no, no, really. I need an interpreter here, but I thank you so much." But just like setting that up is really just like, "Hey, you get I wish I knew more languages, like I wish I knew more basic languages. And there's some of my friends took what is it, medical Mandarin, which so cool and like so important. Seeing you're not gonna like move forward with speaking in Mandarin in a patient encounter. At least like introducing yourself and saying you're gonna call, or even in an emergency, right? Like someone you come up to the bedside and someone's like, "Oh my gosh, I'm in pain." It takes a while to connect to an interpreter. So definitely don't underestimate the power of language as well.
No, I mean, to keep echoing how important like humanities are, especially in language, it definitely should. I mean, that definitely should be really. I mean, I assume that's why almost all med schools have it as a prereq to take a foreign language class, especially in like places like the ER where you need to be able to communicate with a patient right away, no matter what language they are. So yeah.
Exactly. And then yeah, my thing is, I have seen on occasion people who should be using interpreters not using them. And so I think it's very important to know your limitations as well with the language, but just like having a basic understanding of Spanish or other languages, but Spanish especially, I think is so important.
Right. Okay. I wanted to kind of shift more towards Macaulay. So
Yeah.
I know you talked about how Lev and your advisor. Who was your advisor, if you mind me asking?
Charlotte Glasser, she's recently retired.
Okay, then never mind.
But all the advisors are amazing, and I know them all really personally. Like McCall Lounge is really a let's say like a safe space, but totally a safe space for me. The amount of times I cried in there, laughed in there, like I just kind of walked in, I'm like, somebody help me. Like, I did that to Camille as well. But yeah, it's Macaulay. I think as a program is a really awesome. You don't need to be a Macaulay student to be successful at Hunter. You don't need to be a Macaulay student to find advisors and people who truly care about you and will support you. It's just a program where that is built in. And there's other scholars programs where that's also built in, but I was also able to build so much community with the professors by going to like office hours. So I just also want to make that clear. It's like Macaulay was a huge part of my experience, but like I also have a lot of friends who are incredibly successful right now and like in science, in medicine, and they were not part of the Macaulay program. So it's definitely not a requirement.
well, yeah, I mean, so I can definitely echo that as well, that like, you don't need Macaulay. But I did wanted to ask, were there resources that Macaulay did offer, that might have specifically supported you on your medical journey?
Absolutely. I think one of the major things that Macaulay did for me was just you know, like class selection was a huge thing. Just like figuring out what classes to take, being on track with graduation. I think that's one of the number one things that Macaulay offers is just like, okay, how are you doing? What are you thinking about doing? Like, what are you thinking about doing with your life? And then like, how can we help you achieve that? They had wonderful um, like people just around, and so you're like, what are you doing? And I was gonna tell you, oh, I did this like research thing and it was really cool. And you're like, okay, well, how do I get involved in this research thing? So a lot of things were just like word of mouth, kind of like that's just kind of community support. But yeah, I think support was the biggest thing because when I was like really down about like introvert being so hard or like not sure if medicine was right for me, just having someone to talk to about that and like really kind of share my ideas with and bounce things off of and have people suggest things to me about like what things I could do. So one of the programs I ended up doing that ended up being a huge part of my now like my life going forward. I didn't know at the time was I thought about doing physical therapy for a while because I was like, okay, I don't know if I want to do the whole med school thing. It's really long, and I want to have a family one day. Maybe physical therapy will like fulfill the things that I want in a career. And physical therapy is an amazing career, and I work really closely with the physical therapy colleagues as someone who's going to PM&R. But I did the health career what was it called health career opportunities program at Rusk Rehab, which is the rehab program that I did my research here and like where I fell in love with PM&R. But in that program, I worked with physical therapy specifically, and I found out about that program through just like the advisors at Macaulay for like what are some summer opportunities that are available. And that really ended up being that program helped me realize that I wanted to do medicine, that I wanted to be a doctor, and then eventually, I when I was after finishing clerkship, I'm being like, "Oh my god, I don't know what I wanna do with my life." Like, I can sort of picture myself doing a ton of these things, but nothing really fit quite right. And then I was, like, reflecting on that experience, and I was like, "Okay, maybe I should give rehab another shot and, like, see what's up." Like, see what because I didn't actually get the chance to work with any physiatrists during that time. Like, I think there was, like, one day, and then we had, like, a talk, and so I'd heard a little bit about it, but I didn't really know what it looked like. And then I decided to do a rotation in PM&R, and I was like, within a couple days, like, okay, found it. This is what I want to do. Nice and easy. But yeah, so yeah, I think just like it's the experience. Like it's just like having people who've gone through the same thing or like can share fun stuff that they're doing or cool research or a good mentor or a good class to take. Like having those conversations and having like a built-in support system to do that. Like I think that family is what Macaulay offers.
So yeah, I mean, overall, I'm starting to see that like Macaulay was kind of almost like a big mentor for you, like
Yeah.
giving these
Yeah.
connections, these opportunities, these support systems all came from Macaulay, right? Yeah.
Yeah, I felt really supported, and love is a huge part of my life still to this day. So, he officiated my wedding. So,
Oh,
like,
oh, that's nice.
I just, like I really my experience at Hunter was, like, the most supported I have ever felt in my life, like, as I've, like, gone forward, and, like, the people, like and just, like, the professors that choose to work at Hunter, like, these are incredible not everyone, but a good chunk of them are amazing, like, they could work anywhere, and they know how much, like, just, like how do I s what are the right words? Just, like, CUNY students are some of the most, like, passionate, hardworking, people in I will say, in the world, and I think, like, just the experiences that CUNY students have and bring to the table and the community that's fostered, like, if I had the chance to work anywhere as an instructor, like, if I go back and teach, I'm 100% going back to Hunter if, like, one day maybe to teach a seminar or something because just, like, the students that are there are just so awesome and amazing, and a lot of and there's some professors there, like and a good number that really recognize how truly special, like, the community at Hunter is. Although at some points it feels a little bit disjointed, but, like, the students that you find there are so special, and you can really you make your own community in such a big school.
Right. So yeah, I mean, I can echo that too as well as a Hunter student. That I mean, the community here, everyone. I mean, everyone I know are just is just hardworking. You
Yeah,
know,
and interesting. Like, there's so many interesting stories and backgrounds, and it's so cool. Like, I took a class with someone like, I took a was it? It was my intro to philosophy class, and it was I made friends with a senior auditor who was like a lawyer, like, and he was like 75 years old. I was like, this is so wild. And like, what world would I be taking classes with this guy? But I could learn from him. We all learn from each other, and it's a really cool place. I think going to Macaulay and Hunter was the best decision I have ever made, and I can be pretty yeah, I can be pretty
that's good.
confident about that.
That's good to know you're certain about that. Yeah. um,
Yeah, no,
so you know you talked about your undergrad experience and then you graduated with summa cum laude. Congratulations to that as well. Especially in biochemistry. I know that's I mean
it was
yeah. um and then you told me that you did a gap year. Specifically, you were a pre-doctoral research assistant at Albert Einstein College of Medicine, right?
Yeah,
Um,
very fancy title, but yeah, I was just doing
it's a bit
research. But the reason why I got that job was I did a summer undergraduate research program, the SERP, which they have different names and they have them at all the different things. So like when you Google like science research summer program for college students, like SERP is just one of those very like they also have like SURF and they it's pretty similar names, but they're like these summer undergraduate like research immersion programs. And I did the one at Einstein and I got to know the people in the lab, and I pretty much like at the end of the year was like, this was a cool experience, and could I come back for the gap year? I had known I was taking a gap year because when I had started this, I was just like, I'm taking a gap year. There's no evidence for why, but I was like, I'm gonna do it. Glad I did. I think it's are you frozen? Oh, there you are. You're back. But yeah,
yeah,
I ended up being like more of an applicant had initially anticipated, just like with in that summer was like I was doing like this research job and then like I was taking the MCAT really early like earlier in the year and then writing my applications took like all my free time and then I was like doing interviews and traveling to the interviews and I was like oh my gosh this is not the gap year that I had initially anticipated like I thought this was going to be like I work on research for the year and that's pretty much all I'm doing um so I sort of wish I took 2. My brother took 2, and I was like he was, like, I think I'm sure he talked about it on the podcast. I didn't get his episode wasn't uploaded yet, but he's, like, teaching English and, like, on the beach. So, I wish I took 2 gap years, but No, just kidding. I don't really know. I'm happy with the way things turned out, but, yeah, it was just, like it wasn't as relaxing of a year as I thought. I was like, "Okay, I'm really working hard." But sorry, I have a cat, and she doesn't like when the doors close, so if you hear banging, please excuse it. Um, oh my gosh, I'm so distractible. Yeah, so that's how I got the job, was just, like, doing the summer undergraduate research program, and it was a good experience, like, I was doing, like, microbiology stuff, and, like, working with cell plates and something I'll never do again, but I was glad that I had that experience, and one of the major things that was excellent about it was just a fun way to engage in science. We One of the reasons why I really liked that lab is we had a lot of, like, high school students come and work with us, so I got to do a lot of mentorship and, like, work really closely with them, so I got to do a ton of teaching, and then I really my favorite part about science research is, like, talking about it with other people, not the actual doing of it, and that's how I decided not to do MD PhD, because I think pretty much everyone at some point on the MD track, if they're doing research, is like, maybe I should do MD PhD. You've got to love research. Like, I would almost say primarily in order to do an MD PhD, because you could always do research as an MD, but to do an MD PhD is really it's a really long commitment, and I think yeah, I think you have to primarily really love the research. So I really love the talking about the science. My favorite part about science was always doing like the poster presentations at conferences. Um, so I was also a John P. McNulty Scholar, which is a scholarship for women in STEM at Hunter, and that was a huge part of like how I ended up doing the CERT program. Another community of science that like was so influential in like my experience at Hunter, and was like a big part of like how I like got connected with that in the first place, and like doing the conferences and getting conference funding and stuff. Um, but yeah, it was a really good experience, but also taught me that benchtop research is not for me. I do really like the more clinical side. And so I think that I will continue to engage in like research and do more research. I took a research year in med school, but yeah, not benchtop anymore. I'm not working with plates and cells, but I rather work with people.
No, yeah, I mean, yeah, I mean, that's amazing that you were able to find that out during your gap year. All of these.
Better late than never.
I did have a did you do any sort of clinical research prior that maybe stemmed.
It didn't make me interested in it. It was more just kind of like it was, the Weill Cornell had a research program for, like, in the emergency department where we were, like, working on, like, surveys and recruiting people for research studies. So I like, it was cool, and I was like, it taught me a lot about the emergency department and got me really interested in medicine, but from the research side, as a research assistant, I really wasn't focusing on one particular project and, like, seeing that through to the end, and I feel like when you're really doing research, in order for you to truly be participating in research, it's like that you have to have one project and you're kind of like following through with that. And like you're writing the intro, you're doing the background, and you're doing all that kind of stuff. So it wasn't until med school when I first like got exposed to clinical research,
Okay.
or like what I define as like engaging in clinical research as opposed to just like participating in the active research.
Well, that's great to know. And I mean, you did say earlier that you wished you took 2 years. But I mean, overall, I mean, you got into NYU. It
That's
worked
how
out.
they worked out.
Yeah.
You don't need a gap year. No one needs a gap year. I have a ton of friends who did not take a gap year, went straight, and I've got a ton of friends who took many years, like had an alternate career and they came back, and then or did a post back right after undergrad and like you know did like was like an EMT for a while, So there's so many paths to medicine, and it's just like don't let anyone try and tell you that there's like one way to do it because there is not. And NYU is an incredible med school. Like I'm so glad I had the opportunity to go there. I really learned a lot. It was such a privilege, like especially like working at Bellevue, um, like meeting my classmates, just like phenomenal people. The instructors were amazing. Like preclinical was so much fun. And I really just learned so much and got to see so much. So I'm so grateful for my experience there. But one of the things I learned is like, the path to medicine looks so different for so many people. And I think especially at Hunter, where, people don't necessarily look like the average like pre-health applicant, like they have like they have different like backstories and lives, and we bring so much of ourselves into medicine, and really medicine's just looking for good people. So if it takes you a couple years or you just go straight, like you'll really find your way.
That's reassuring. That's good to know that. I mean, like, there's not like one strict thing that you have to do. Everything happens for basically a reason. And
Yeah. You don't have to major in biochemistry either. I knew a lot of people who majored like, some people majored in English and history. I was like, "How the heck did you do that? Because how how'd you get all these prereqs done?" But they did it somehow, and they were like, "That was what I was passionate about. I really enjoyed it." I'm like, "Cool." I had a couple friends who majored in Spanish. Like, I was like, "That was a really good idea." Like,
Yeah,
that's really cool. And so there's just, like, so many things that you can study. I think, honestly, biochemistry was a little bit of the easy way out because it's just so many of those courses are, like, the pre-med classes. So that's why I'm like, I'm glad I did the certificate in public policy, but you don't need to major in biochem, especially if you don't like it. Like, if you're not into it as much, because being a doctor does not look like solving organic chemistry problems.
that's reassuring to know that. um,
Yeah.
So, I mean, yeah, going off of the success of you getting into medical school, you made it. You're one of the lucky few. So I mean, you also went through the medical school experience. So congratulations on graduating from medical school as well. I mean, that's also a major stepping stone. So I wanted to ask, how was your medical school experience? Was it different from your undergrad experience? Was it harder? Was it maybe even shockingly easier? Like, how was it overall?
Um, I think for me it was easier, in some ways and very difficult in others. And I'll explain what I mean by that. I think one of the every med school is structured differently, so I can only speak from my experience. And now NYU is even structured differently from when I started. Now it's like a 3-year program instead of a 4-year program. So I don't want to speak to like what the experience is like there now, because I have no idea. But for me, coming in preclinical was 1.5 years, and it was awesome. Like, I really enjoyed the preclinical clerkship, or, like, a preclinical curriculum. We had all these, like, really cool lecturers, all of them were, like, specialists in their field. It was split up into, like, different organ systems, so, like, on one hand, I felt like you kind of lost that mentorship aspect in the sense that, like, when you were taking bio, you had, like, one bio teacher, and you had that teacher for, like, a semester or even a year. Whereas opposed to in med school, when you have a lecturer, they're there for, like, a couple of lectures, and then they're gone, and then or you move on to the next organ system. So there's some benefits to that, which is just, like, you are really hearing from the experts. You're hearing, like, from people who are so passionate about what they do, and that's their entire lives, and they're delivering you this information. It's really cool. I felt really intellectually stimulated, like, I really enjoyed the lectures. I also like pre-COVID when I started med school before COVID started, and I would go to some lectures in person that I was like, I really like this lecturer, or they seem really interesting, or the topic was really cool. But most of the lectures I watched at home on 2x, like after they're recorded, which worked really well for me. I'm speaking at 2x right now, I think, because like I slow down with patience. Don't worry about when I get comfortable, I go off. I just get really fast. So my brain likes to work like I like to listen to receive information pretty fast too. And so that style of learning worked really well for me. I would also find myself like, sometimes sitting in lecture and be like, oh my God, this needs to be faster, like in undergrad. But in med school, I got to like, learn at my own pace. And I got to like use different study strategies, like things like sketchy micro, which people hear about. A lot of people like Anki, like using like Anki decks. I didn't like it. Like I just like didn't work for me. So I didn't use it. Like I didn't have to. I would like watch YouTube videos. Group study again was a huge part of my med school experience because that was what I knew worked really well for me. Um, so I really enjoyed preclinical. COVID hit, totally different. So weird going to med school like on Zoom when there was no chance to be in person. They sent us home, and that was kind of devastating because you're like, I want help. Like, and there were some ways that we could help, and I did engage in this. Like, we had things like New York City COVID Connect, where we would call people with their negative test results and explain what they meant. And it was just like it was really hard to like not be able to do the like do medicine and like help people and like during such a horrible tumultuous time in the world. It's just like I'm so close to being here and like doing the thing, but now I'm sidelined, and that was kind of tough. So I started working with the asylum clinic and doing some things virtually with them, which is more formally known as the Bellevue Program for Survivors of Torture, and that was a huge part of my med school experience, and like started during COVID, and then I continued throughout like my entire time. Um, Clerkship was really hard for me, like the adjustment to clerkship. I just found like, some clerkships were like easier than others. Sometimes I clicked better with teams than others. I think one thing about clerkship that I didn't anticipate is that sometimes the feedback feels really personal. Because like they're evaluating you just like based on like who you are in the hospital and who you are as a team member. And that can be, like, kinda hard, like, yeah, sometimes you'll get feedback and you're like, "Damn, like, I didn't know, like, I was coming off this way, like, that sucks." And that was tough for me at first, but then I felt like once I started to really kind of focus less on like what the like my feedback was great. Obviously, I got into like a good residence program, so things like worked out really well. But like when you're in it, you're like it's like the hours are long. You're like doing a job that's like you're not getting paid for. And luckily, I wasn't paying for it, but a lot of students are. And then you go home and you have to study like tangentially related material so you can pass your step exams. And so like that was really tough. Um, I actually kind of felt like I found my stride way more after clerkship year when we were doing like electives and like sub-I, like where you like are like kind of like a mini intern. Like I just felt like so much more comfortable with like what my role was and like how to be a team member. It was just like much more well defined. 'Cause sometimes you show up and they'd be like, "Who are you?" like for like certain clerkship, and you're like, "Oh hey, like I'm here and we're going like," and I don't know. So I think there were times in clerkship where it was really tough and I was like, "Oh man, I really hope that I made the right decision." And know that I'm looking back on it in retrospect, I know that I did. There's nothing else I would rather do. I'm so glad that I found PM&R and I know that that's like the career that's going to make me like help the most people in my life and I'm just going to like feel the most fulfilled by doing it. But I was like, "Oh my gosh, like, is this what medicine is?" Like, there were certain times where I was like, "Are we really even help people doing this stuff?" And it's hard. No one wants to be in the hospital too. Like, and the only like there are some exceptions, but I'd say a majority of your clerkship time is just like in the hospital, and that's not necessarily everyone's place where they thrive. I'd say it's very few people thrive in the hospital. But there were certain definitely times at clerkship where I was like, "This is awesome!" Like you seeing a baby, like someone give birth to a baby for the first time, like participating in a surgery and like when they let you like help, and like I was even like a first assist once, which was crazy. Which like other surgeons are like, "Well, you did what?" Like, I like got to on ortho, I was like helping with like using this like saw, like it was like like I got to do some crazy stuff. Even like neuro, like I really like neuro. There's so many things about like med school that like they surprise you, and I think, like, going into it each clerkship with an open mind really made my experience a lot better. So for example, in preclinical and even in undergrad, I was, like, not really into neuro. I was like, "Okay, this is a lot of details. I'm not crazy about memorization, and I don't really like how this whatever is so much detail. I'm not a fan." I like processes. I like seeing how things, like, naturally work out, whatever. And then when I did the clerkship for neuro, I was like, "Holy shit, this is pretty awesome." Like, I really, like, enjoyed seeing these things, and, like, doing the neuro exam, like, I fell in love with doing the physical exam. It's just, like, my favorite part of medicine and a really kind of telltale sign that someone should be in PM&R, I think, is if they love the physical exam. Um, but I was really, like, even when you're in the ED and you see someone and you, like, diagnose, like, their condition, they're just, like, seeing someone for the first it's awesome and, like, so fulfilling. So, I don't wanna, like, get anyone down by saying that there were definitely but I'm gonna be realistic and, like, there were moments where I was like, "Okay, this is really tough and I'm not sure if I made the right choice." But then, shortly after you participate in something, you're like, oh my gosh, I literally cannot imagine doing anything else. Like, what a cool thing to be doing. And that's why, if someone is on the fence about pre-med, I'm really like shadow, like get the experience, talk to doctors. And there'll be people who tell you don't do it. Like I remember there were certain times like when I was like shadowing doctors or I went to a doctor and I was like, I'm thinking about being a doctor. And they're like, oh, don't do it. I'm like, well, that's not helpful advice. But I think having a healthy dose of like medicine is going to be different from what you expect. Like, and medical school is gonna be different. Being a doctor is gonna be so different. But like you want to be sure that this is the path that you want to take because once you start it, you're kind of locked in. Like once you're like in medical school. I mean, not always. Like I know people who chose not to go to residency or to do something else after they graduated with the MD. But for the most part, it's like, when you're choosing this and when you're applying to med school, you really want to be sure. So like get your experience and get your shadowing in, talk to doctors, watch YouTube videos about people's experience and like, you it's nuanced. Classically. Everything is nuanced.
So yeah, I mean, yeah, I'm starting to see that as well based on your response that I mean, overall, your med school experience was very different from your undergrad experience from what I'm starting to see.
I mean, just by nature of the structure, right? Like, so preclinical is the closest that you get to the undergrad experience where you're in class and you're taking tests. Um, but you do have some like bedside stuff and like do some like cool things and like whatever. But the structure of the classes are so different. Like, it's just not the way that you go through undergrad. It's like people will teach you a certain lecture, and there's like people who are in charge of a certain unit. Like there's a director of the cardiac unit, for example, but each lecture is by somebody else.
Right.
Um, and so in that way, it's different. Also, some med schools like mine, which was I think one of the main things to look out for in a med school, is our pre-clerkship curriculum was pass fail. So you get a grade on the tests, but your grade doesn't like count for anything. Like it's not like, oh, this is my grade in preclinical, which I think, and like honestly, my test scores were pretty great. Like I scored between like I got 100 on a test once, and that was on histology. Our histology teachers were awesome. So like that was crazy. And I got that back and I was like, but most of my scores range between like 80s and 90s on the exams. Um, but having the pressure off of like getting an A, like getting the best grade you possibly can, was like such a relief and like was so good for my mental health. And also I think made me learn better and kind of took a lot of the pressure off of like getting a question wrong. Like there would be certain things that I was studying and I was like, I'm taking the L on this one. I'm just gonna take the L on this question and that's okay. And I'm gonna move on and that's fine. As opposed to like in undergrad where I'm like, oh my gosh, like I've got to go back to it. Like I don't know what the answer was and blah, blah, blah. And I would get stressed about it and I think about it after the test. And so I had some like pretty unhealthy ideas about like getting good grades and like how to, and I think med school made it was much easier and I just made the learning process so much more fun to not focus on the number. And I think like if I could go back and tell myself in undergrad, be like, it is okay not to get an A on everything. Like you will survive. Like you will like and you'll still be a doctor. And like that's like it's okay. And it's part of like learning and growing and part of the best way to learn is to get things wrong and to reevaluate and to change your study strategies like I did for that bio class. But yeah, just relax. Like take it easy on yourself because if your mental health is suffering, you're not going to be able to absorb information as well and you can't take care of people without taking care of yourself. It's like the classic, like you're on an airplane, you have to put your oxygen mask on first. Like in order to be a good caretaker or care provider, you need to take care of yourself. And so I think med school helped me really find that balance of like, okay, so when I was going forward in like the standardized exams, like step one became pass fail before I took it. And obviously that was a huge relief. I was like, great, this is awesome. Because it's not like I don't think step 1 is like a good reflection of like what kind of competitive specialty you can get into, and it's just so fun. Like I'm just so glad that that change has occurred. But even step 2, I was kind of like, I'm gonna get like when I was taking the practice test, when I started to get a score that I was like comfortable with, I was like, yeah, this is good. I'll take it. The MCAT, I like pushed back a few times, and I'm glad I did because I think my I'm kind of skipping around, but hopefully this anecdotal stuff is good. Someone's enjoying it and you're enjoying it, but with the MCAT, like, don't take it until you're ready. Like, the AAMC practice tests exist for a reason, and they are wonderful and predictors of your score. If you are not scoring what you want to be scoring on those exams, you need to reevaluate your study strategy and start again. And I did that. Like, I kind of like haphazardly took this course, like the exam crackers course, and I was like sort of doing it, but like really focused on school because my classes were really hard at the time. And so I was like not really doing as much as I should have, like prep on the side. I was taking some practice tests and I was like, I know I can do better than this. Like, this is not a reflection of like how much I know. And I know that I can improve the score. So my brother ended up taking the MCAT like way before I did. And then I took some extra time and I ended up taking it in July, which is way too late. So like planned better than I did. But I really gave myself time. And if you have to take a gap year, right? Like and so I gave myself the extra time to study, to totally change my strategy. I love the exam crackers prep. I ended up using that for my own prep and start when I started from the beginning. I literally started from scratch, like from the page 1, book 1. And I, got to take other prep examples like Altius prep. I shared, I probably shouldn't say this on public prep, but I shared my login. So
Oh,
it
wow.
was cheaper. And so I used their tests and I use and they're excellent. Those were like I think they were partially scored, but they were amazing. And so so glad I took those tests. I did a ton of cars practice and I was doing like the free stuff and like I got the extra book and I think your study plan is not anyone else's plan. And so you have to do what works for you. And there's so many resources online about how to study and how to set up an MCAT study sheet. It's like you can take things from other people, but you really just got to find your flow and what works for you. And And so, yeah, I took a lot of time and, I got the score that I wanted, which got me into NYU, which is like notoriously really focused on scores. And, like you can, and all this data is publicly available. Like when you look at med schools, like what is their average MCAT, and so you can take a look at that and just be like, okay. But yeah, for the steps exams, I think it was also maybe I felt a little bit less pressure because I knew that I wasn't really interested in the specialties that are like really score heavy and score focused. So like the things that people think about are like ENT, ortho, derm. I was just like those things, neurosurgery, like that just like didn't really fit with like what I wanted to do and like where I could really see myself. And so that took a lot of pressure off. And so felt like I just still did well on those exams, but reframing my med school helped me reframe how I felt about academic success and what that meant for me and what it meant to like learn and be a good student. And then clerkship helped me was totally different from any experience I ever had. Not comparable in any way to any education I had before that, but clerkship helped me really redefine for myself like what it means for me to be a successful doctor and like and it was like as the year went on, I was like, okay, I'm getting feedback from some people whose opinions I don't necessarily agree with. And so there's some things that are really helpful and some things that you take with you. And there's some things that you're like, okay, yeah, I appreciate that feedback. Thank you so much. And I didn't incorporate it into my practice moving forward because the my personality is so different. And so the way that I practice medicine is different and the way that I have patient interactions may look a little different. But I think you really have to define what it means for yourself to be a good doctor. And then taking feedback is hard, but there you really see what you want to incorporate. And there's certain things that you might just be like, okay, well, that's, okay, thank you. I appreciate that comment. And I'm gonna move on from it. So yeah, that's a long-winded answer, but that's just my experience.
No, you gave a lot of really amazing tips and experiences that, I mean, both me and a lot of viewers are like just like sitting here like, wow. So,
Well, it's hard because people don't really like. I didn't know anyone who was a doctor. Like I didn't grow up around any. I'm like, I guess in retrospect, I was like, there was a family friend I could have talked to, but like, I didn't have any like close family friends or like anyone in my family who was a doctor. I didn't know anyone who had gone through this or talked candidly with anyone about this. And so it was really like when I was going through it, when I started to like kind of figure this stuff out for myself. And so like as for me, I'm major part of my medical school experience was like engaging in mentorship and working with the first and second years and like as I like proceeded on. But yeah, it was really tough. Like it's a tough time. It's like it's hard when you don't know what you're getting into, really. And I think it's really impossible to know what it's like until you're really in it. But you can get a good sense. And so like while social media can be a crazy thing, and we all know that there's like, there's many faults. One of the things that it does do is open up our world to get kind of insight into so many other people's experiences, and you can really like kind of see what other people are going through and talk then like not really like we have these parasocial relationships with people to be like, okay, what is their medical experience like? And you can get a much better insight on that than we could have like 10, 15 years ago.
um, and I think this leads into my next question. And you kind of, I think you really answered it already. Like mostly, I mean, you seem to have had a very successful journey on like your medical career. However, I know that there could be challenges on that journey, definitely. So I wanted to ask if you did face any challenges on your medical journey, if that's undergrad, if that's applying to med school or in med school or applying to residency too, which I was going to ask later on how that experience was. But if there were any challenges, what were they and how did you overcome them?
Yeah. So I mean, of course, there's so many challenges along the way, but I think one of the major things that I struggled with was like am I good enough for this? Like, am I a good doctor? Like, how do I be a good doctor? Like, how do I be the best doctor I can be? It's a difficult question to answer because it's different for everyone, right? Like, everyone's medical practice is so different, and every doctor is so different. And sometimes you look around and you're like, these people are practicing medicine in a way that, like, I don't want to do it that way. Like, I don't think that this is the best thing. And so, like, for me, I think one of the one of the things that I'm most passionate about is just like really helping people like figure out how I can make their lives better. Like and working with them to find out like what are the things that they're struggling with and how can we address those things so that they can maximize their quality of life and just feel like they're like living the way that they want to be living. And I think that's such a the reason why I found PM&R and why I resonated with it so much. And also I've said this so many times, but I never actually said what PM&R is. But so PM&R is physical medicine and rehabilitation. There are medical doctors that specialize in disability and function. So to people who like know about medical specialties, I like to describe it as like if neuro, ortho, and primary care had a baby, that is PM&R. Because what you're really doing is a lot of like peripheral nervous system stuff and like the interaction between the so for example, PM&R can see anything between like they do spinal cord stuff, they do prosthetics and orthotics, they do pain management, sports medicine, which I might have said already, just kidding. TBI, like which is traumatic brain injury. So the field is really wide. Like there are so many things you like pediatrics you can do through, or you can do pediatric PM&R where you're working with kids with like cerebral palsy or hypoxic brain injury. And so it's really such a like a wonderfully like wide field. The main idea of it is like you're really focusing on function, disability, maximizing quality of life. And so that looks really different for each patient. And so I think that the thing I struggled with in medical school was like I thought medicine was more like what PM&R was. And I was just so glad that I found that field because I felt like there were certain times when I was in the hospital and I really struggled with like I feel like we're not doing enough for this person. Like I don't feel like we're solving a problem, their main problem, and we're kind of like letting them go and like you're not letting them go, but like we're discharging them and they don't feel right yet. Like they don't feel healthy yet. Like they can't go back to their lives. And I just felt like people would leave and I'm like, "Oh god, like I wish they were just staying a couple more days. There was like a couple more things we could figure out." But just the way that our medical system is structured, of course, no one wants to be in the hospital. But I felt like there were times where we were discharging people where I was like, I don't think they're ready to go yet. Maybe that's just me. But I really like PM&R because I felt like it was just like we were really kind of helping people get their ducks in a row and then following with them through recovery because getting over the initial, like, hump of the illness is so important, and the things that medical doctors do, like medicine specialists, like internal medicine specialists do is so, so important. It just wasn't for me, and I thought it would be, and so that was, like, a hard realization, and I'll be doing a year in medicine. I'm at Mount Sinai Morningside West, which I'm so excited for, and I think it's gonna be an awesome experience. I'm gonna learn so much, and I'm gonna be able to take that into my future practice in PM&R. But yeah, I felt like I was just like, are we doing the right thing? Like, and obviously the medical system is, sometimes you discharge someone from the ED, you're not really gonna admit them, there's nothing wrong, but you're not really solving their problem, and you're like, "Did we help this person?" Like, I hope we help this person. And so really more of like an internal struggle of like, I hope I'm doing enough for these patients. And, I would do it in my own way. Like, I would just like find ways. As a medical student, the greatest asset you have is time. And that sounds crazy because medical students have no time to do anything because you're always studying, whatever. But in the hospital, doctors are carrying crazy patient loads, like doctor residents, attendings, they're taking care of the whole team, right? Residents have like huge lists that they have to take care of. As a medical student, like you have the privilege of taking care of like, 1 to 4 patients. And so you can really do so much, right? Like I had one patient who was being discharged and was actually like on his way out the door. And he was like, I don't know how I'm gonna feed myself. And I was like, that is bad because if you cannot feed yourself, then you cannot like how can you survive? Like like he didn't have the mobility. He was like, I don't know what I'm gonna do. She's like, "Okay, well, what can we do?" So I called City Harvest and I was like trying to see if we can get him for like Meals on Wheels. Turns out there's a crazy waiting list, and I found out that New York City COVID Connect for at the time what would be able to help elderly New Yorkers or those with mobility issues to get meals so that they wouldn't be exposed to COVID because they were like higher risk. So we're actually able to get him set up with some food and some transition before his next appointment with the doctor. But like as a medical student, it's just like there are certain things that you can do that the team just does not have the time to be able to do. And who really help. Even just like sitting there and talking to someone and explaining to them, like, what do you know about your diagnosis? Like, what do you know about the medications that you're taking? And then having those conversations is something that we have the privilege, yeah, and those kind of conversations, obviously everyone should be doing. Like, we need to be talking to patients about their diagnoses and their medications, but especially as a medical student, like, there might be something that's not related to the reason why they're there, but, like, peripherally related, like their diabetes, and you have the time to sit there and have certain conversations with them that the care team just isn't able to do because there's so much on the plate, and so, those things kinda help me feel more fulfilled in those when I was struggling with that, but, yeah, I think as a medical student, those are things that those were like the icings on the cake. Like those are the memories that I have, like just like sitting there after the day is done with a patient, like talking to them and hearing them, listening to their struggle and empathizing and just really being a person and being there for them is something that is like such a privilege that we have.
Yeah. Um, I mean, yeah, I mean, that is, yeah, I mean, that's something that I didn't really even know that med school students even like are able to like have very short patient loads and that you're able to, I guess, be more uh connect more with your patients. So I mean, that's amazing that that was able to influence you in a way. And I guess that also leads into my next question a little bit. I mean, overall medicine, you know, trying to get into the medical field is really stressful. I mean, you go through lots of ups and downs on the road, but sometimes you just have to do things that you love, you know, outside of medicine, outside of science, you know. And I know you spoke a little bit about softball, right? Those are one of the things that you like to do. But I mean, if there were any other things, like what, I mean, like, were there things that when you had the time that that you like to do that were like outside of your, you know, medical extracurriculars or your, you know, your education, just like were you able to enjoy yourself, and if so, what were those things?
Yeah, and I think also it is a requirement to participate in those things, right? Like it's a requirement to sit down and cook yourself a nice meal sometimes, like a nice healthy meal, and like have some like nice unprocessed food that you like prepared yourself and learn a new recipe. And so like that was a couple of ways in which I really found like a nice outlet where like sometimes at the end of the day you're so exhausted, you're like there's no way I'm cooking right now, and that is fair and valid. And like you wouldn't catch me on my surgical rotation cooking a meal for myself at the end of the day. So that's I've been meal prepping, working on the cooking on the weekends and stuff. But, yeah, like, cooking yourself a nice meal, like, food is medicine, and I really think that that's one of the things that, like, you do learn a little bit about medicine, like, in medicine when you're talking to patients about, like, diabetes and, like, what they eat and, like but not as much as, like, as you should, I guess. I'm not really I think NYU did a really good job about it, but I know that, like, generally med schools, it's just not as large of a part of the curriculum in such an explicit way of, like, what kind of foods people should be eating. But so yeah, I think like treating food as like medicine and like learning medicine is a really fun way to go about health and wellness, right? And also taking care of yourself physically. Like, not everyone likes to lift weights. So I find lifting weights kind of boring. But finding activities that make it really fun for you to engage in physical activity. Like for some people that's yoga, for some people that's like kickboxing, for some people it's swimming. So like finding a hobby, volleyball, softball, like whatever, but like finding something that dance is a huge thing. Like people love like I have a lot of friends who are dancers and they love it, and that's where they get their physical fitness from. And it's really good for your mental health and just like such an important part of your wellness and just like stress management overall. But also things like engaging in the arts. Like I think you don't have to be a good artist. One of the things my favorite things to do is you're a poor student and you can make presents for people's birthdays and for your friends. And so I got into like wood burning, like using like they call it a pyrography pen and like burning into wood, like making little boxes for my friends or little pictures on like a scrap of wood, which was really fun. I like really enjoyed doing that. And just like I call myself a notorious hobby hopper because like doing things like making like a little crochet. I made my brother like a crochet octopus, like things like that. Like just like finding ways to occupy your mind and your hands outside of like learning medicine, or even sometimes like I'd be like listening to a lecture and like making a friendship bracelet or something, just like fun little cute little thing on the side. But you have to find the things that bring you the most joy. And a big part of that, I know I said support system a lot, but like hanging out with your friends, have a movie night, have dinner together, everyone come together, make tacos. Like someone can bring the guacamole, someone makes some like some meat, someone brings potatoes, like just really like finding space for community and fun and sing along to your favorite song on the radio. Like I really think it's important to hold on to those things that you like, because it's so easy to forget about them when you're so wrapped up in all this crazy process and crazy journey. And there's been times where I remember my first year of med school. um I was like a couple weeks in and I was sitting there and I was like, I feel like I don't have any hobbies anymore. And I was like, I like Googled, it was like a list of hobbies. I was like, what do I want to try? Like, and then I just like found some stuff and I was like, I'm just going to do this. Um, and that's like where I like the crochet pyrography and like things like that came from. I was just like, I'm just gonna do some fun stuff that I think like seems interesting to me at the moment, and I'm just gonna like roll with it. But it's just like you cannot learn if your brain is overloaded. It's just you're not gonna be able to process information, you're not gonna be able to integrate that information, and the same thing with, like I said, with sleep, like, you need to take breaks and you need to sleep, and those are, like, huge parts of, like, relaxing and taking a break is, a requirement for, I think, academic and, like, career success.
So I'm gonna reiterate one of the things that you said, that having a taco party with friends is a requirement to.
Oh, yeah, no, that I agree, that's a doctor's orders.
Got it. All right. Makes okay. Got it. I'll make sure of that. But yeah, I mean, that's amazing being able to do the things that, I think one of actually, I think that's one of the really big things amongst like a lot of pre-med students is trying to find a hobby, right? I mean, you're just so like time consumed with classes and all these extracurriculars that you just don't know like what is fun like anymore, So yeah, I mean
And
that's
that's a shame, right? Like, you don't ever wanna lose sight of that, and because it makes the process so hard, and you know what? Even when you have those things, there's gonna be times where you struggle. There's gonna be days where you're like, "Ugh, I'm not feeling this today," like, what a not good day to have to
right.
learn. But also, I think, learning itself, it can be fun too, like, and, like, I think that that's also important to acknowledge because, like, there were certain lectures in my school, like, "This is really fun, like, I'm learning a lot, and this is really cool." Like, I think I found Sketchy really entertaining, which have you heard of Sketchy Micro or Sketchy things before? It's a classic med school thing, but it's how people, like, learn, like, medications and side effects of, like, infectious diseases, like, certain like, bacteria, viruses, fungi. They have, like, an amazing series, and they're these little cartoons with, like, memory devices, but, yeah, I think yeah, so that's just, like, one part, like, yes, learning is fun, and, like, we wouldn't do like, not that we wouldn't do this if it wasn't fun, but there's, like, a privilege to, like, being able to learn this stuff, and, like, it is cool, like, it's really cool to have knowledge, it's cool to be able to help people with your knowledge, and I think that's, like, one of the key aspects of, like, medicine, right? Like, it's, like, the application of scientific principles to empowering people to improving their lives, that's cool, but you gotta be able to break from that, chill, find stuff that you like, take time for that because when you look back on your college experience, if you were just studying all the time and you did nothing else, that would be a huge shame. Because when I look back on college, some of my best memories are studying in the library with my friends, but also like, going out with my friends, hanging, like you going doing fun things, going on a hike, like taking a day trip to Cold Springs and like going on a hike there. So yeah, it's important to really find a balance and it is very, very hard to do so. And I can definitely acknowledge that.
Yeah, because I mean, like, one of the hardest interview questions or questions to be asked is, "What do you do for fun?" Because, like, you come prepared with all of these things that you've done, but, then when it comes down to, like, what do I just like to do just for the fun of it, it just gets so hard to just think
Do you
about
have
that.
anything, Isaiah? What do you do for fun? I'm
Me
gonna flip the
personally,
script. Yeah.
I don't know. See, like, I
Oh,
genuinely,
yeah.
I don't even know if I can answer that question. Genuine, I mean, like, almost everything I do personally is like medical related. I mean,
So I'm gonna give you some homework. You get in the next I'll circle back in a couple weeks. I want you to find something that is just for you and just for fun. And whether it's like, a video game that you play or just like going out, like going for a walk. Maybe it's a little more than that, but find a hobby that you're like, this is what I'm doing for fun. And I will circle back with you and we'll because that is so important because you need to have stuff that you do for fun. This podcast, I'm sure it's work, but it's fun. Talking to people's fun. Connecting is fun, of
yeah,
course. But I want you to have something that's totally unrelated to medicine, pre-health that you do just for you because I was in your shoes and I found like I lost that. Especially there were times like especially after I had decided I wasn't doing the softball team anymore and I was just gonna do and I was like I'm gonna get doing the pre-med stuff that I really wanted to do and like get on my resume and I found a lot of fun in teaching and doing like peer health exchange, but it was all medical. But so I had to sit down and be like, okay, I need to find other hobbies. Like if I'm not playing softball right now, which I end up rediscovering later and like doing like a Sunday softball league, but I need to find stuff that is just for me and like just for fun. So that's your homework.
got it. I didn't know I was gonna have homework this summer, but new assignment. Thank you. I'll make sure to turn it in very soon.
There you
um,
go. Also, circle back.
and speaking of which, I mean, this is one of my favorite questions to honestly ask because I always get different answers from everyone. So I mean, honestly, you specifically, I'm really interested in hearing your answer to this. So moving to the next question, your journey applying to residency specifically. I wanted to ask, was it easier or harder than applying to medical school? And I'm saying I've heard so much different from every person I've interviewed. So, I
Yeah.
mean, like, can you tell us your journey for applying to the residency? Do you maybe even have some tips? Even though that's a long way down for a lot of the people who's watching this podcast, like, do you have any tips for us? And yeah.
Yeah, I'd say so it was much easier for me than when I was applying to med school because I was so much more sure of myself. Like, I just, like, kinda I learned and that just comes with time and it comes with experience, but I learned more about, like, who I was, what things I was confident in, the things that I was doing, the areas in which I have to grow, but the things that, like, I've kinda learned along the way, and I was just like, I'm a you know, I guess really just being confident in the fact, like, I know I'm gonna be a good intern, I know I'm gonna be a good resident to have, and, like, I know that I'm gonna add to your community and be a good part of this team, and, like, I could see myself you're like, it's just, like, coming in with that knowledge, I think made me just, like, so much more chill when I was going to the through the interviews. It is different depending on what specialty you have. I think my specialty, I felt like the interviewers really just wanted to get to know me, and I didn't feel like I was being tricked or asked, like, crazy questions. There was a couple of schools where they, like, posed, like, patient questions or, like, the classic um, yeah, I'm not allowed to talk about the questions, so I won't. But there were some schools that ask you like totally wild, out of the box questions, like that you might get in an MMI that are like not that are like, what would you do in this wildly on like crazy circumstance? And you're like, okay, I guess I'll just go through it. But so yeah, I found it easier just because I was like, like when you kind of go into the confidence of like, I'm gonna say some stuff that just kind of comes out of my mouth and whatever. Like, there was definitely interviews where I was like, "Why did I say that? Like, why was that what was my response? Like, what would you do if you didn't wanna do medicine?" And I was like, "I can't." I just said, like, something so silly, and I was like, "No, you wouldn't." Like, what? But so there's gonna be times where you put your foot in your mouth, and you kinda have to learn to just shake it off and just be like, "Okay, whatever." No one's gonna hyperfixate on the one thing that you said the one time. Like, an interview is so long, there's so many things that come up and whatever. Like, you just kinda have to, like, have a good conversation, be yourself. When you're at that stage where you're interviewing, even for med school, for residency, this all applies. They're trying to see, like, do I think this person would be a good member of my community? As in, would I like to be around them, work with them? Do I think that they're gonna make a trustworthy person to work with? Like, and do they yeah, are they personable? Like, do I enjoy this conversation? Like, I think kinda keeping that at the key of, like, they wanna know they just wanna know you, like, they wanna see what you're all about, and so, like, being authentic is important, I think, in an interview because you wanna see what place fits best for you as well. Um, so that is one thing. And yeah, I some other tips I have is just like, yeah, don't worry about the specific things you say too much. Like, no one's gonna really remember like the exact words that what there's some Maya Angelou quote. I think it's just like no one's gonna remember exactly what you say, but they'll remember how you made them feel. Something like that. Don't quote me, but it's like something along those lines. But it's like that idea of like the impression you make is so much more than just like a couple of words you might have slipped up on or an answer you might not have like, answered properly. Like you gotta let things kind of roll off your back. I remember when I did my NYU like MMI, the multiple mini interview, I called my mom afterward. I literally like I stepped out of the interview like when it was over. I was walking home. I called her. I said, "Mom, there's no way I'm getting into NYU. That was bad. That was bad." And she was like, "You don't know. Like you'll see what happens." And I got in. And um, we're our harshest critics, I think. I think it's also a classic pre-med pathology in where we overthink everything, especially what the things that we do. And one thing I'm still trying to learn is like, and my husband said this to me all the time. He's like, if your friend said something like this, how would you react? Like, what would you say to them?
Mhm.
Like, and I'm like, you have to be, and I have to be, we all have to be. This is, I think one of the things is like when you're going through this process, you're in this rat race for like such a long time, and breaking those habits becomes an important thing to start working on. And so, like, I was like, look, if my friend had said these things, or if my friend had thought this way about themselves, what would I say to them? And then trying to apply that to myself. So that's a lesson I'm still trying to learn, but like I think a really great way to frame things. Because your friend's gonna be like, "That's so funny, dude. Don't worry about it." Like, I'm sure the rest of it was fine. Like, or it's not as bad as it's usually not as bad as you think. Like, no one's gonna really overthink your answers as much as you are going to do so. Um, so yeah, I think like just being authentically you. One of the things I found really hard that I hope changes when you guys are eventually applying for residency is like I wish I could just see more of the places that I would have gone. And I don't think it would have changed much about like my decision making because there's so much involved. I got to watch a little bit of Nick Brutus's talk, like his interview from a while ago, and he was talking about like the things that are important when going to like choosing a medical school. And like things come up, but, like, it's the same thing with residency, like, your priorities change, and, like the things that are important to you, like they matter. And like for example, like where you want to, if you want to settle down and have a family, where are you going to be? Like what is the location that you're going to, maybe location jumps up on the list for something that's important to you, or it goes down. You're like, I don't, it doesn't really matter where I am as long as this program has XYZ. And so they're your priorities, right? Like you need to figure that out with like your family, your friends, whatever. But like your decision making isn't just like what is the most prestigious program that I can go to. And it's a hard cycle to break because when you see a fancy name, you're like, oh my God, I want to go there. But is it really the right choice? And when you submit that match list and the rank list, it's like it's a tough thing to do, because you don't really get to see at least when I did it, you meet people, but you meet them on Zoom. Only one of my interviews were in person. um, so you meet people on Zoom and you interact with some people in the school on Zoom, but you're not seeing the space that you're going to be working and living. Like you're not really meeting everyone. You're just kind of meeting the people that are the ones that are there doing this thing. So you're getting like by a selected sample of like, so I think it does make it hard. And it's tough and it's hard not to think of like, oh, well, what if I rank this place first or this place first? And yeah, there's in life there's going to be always so many roads. You're only going to know the road that you take. And so I think like learning to kind of shrug off the uncertainties and just kind of be okay with the decisions you made. It's just something like, this is the life that you're living. It's the only one you got, and you got to make the most of it and try and enjoy as much as you can.
Wow, amazing, amazing response. Yeah, I
I'll
mean,
take it because I feel like I'm rambling so much.
no, I mean it's not even a ramble. It's all of this is important to think about. I mean, these are all things that people, I mean, that I've never even thought about. I mean, I'm not applying to residency, so so I mean, I haven't
Yeah,
really.
it's also like med school too, right? Like, maybe for you, family circumstance makes you want to stay in a certain location, um, or or you have more freedom, right? And for me, also, like I said, when to NYU, like I think finances it should be an incredible, if not the most important thing that you're thinking about when you're applying to medical school, because you maybe take like it's really important. And your financial health is a part of your overall health as well, right? Like the food that you can afford, like the life that you can have. And it's tough. Like it's tough to take on that many loans. And I think, yeah, finances are a huge part of where you're deciding to go to medical school.
And correct me if I'm wrong. Have you ever had to pay for school before? Because you went to Macaulay and then you went to NYU. So I'm
Yeah, I'm also a New York City public school baby, so I actually haven't had to pay for my education. So I am incredibly blessed and lucky to have received this. But I see it all the time with my friends. Like I have a lot of friends who have taken on a lot of debt, and I see how like it impacts the way that they think and the way that they plan their futures. And when you hear about like there's a ton of podcasts out there about like financial health, and you see what's going on in the state of this country, people with student loans, and it's crazy. And so like I consider myself really lucky, but I also like this was something that when I was applying to college, I know my parents they weren't gonna be able to afford to send my twin brother and I to school. Like that was not like a thing. Like they were like, okay, yeah, we'll go to this college, you're gonna be all good. You're like, you can pick wherever you want. Mike and I were like, okay, we're gonna go to med school and that's gonna be really expensive. So let's find out what schools have scholarships. We were like Googling like free college, like applying to state schools, applying to scholarships, applying to all that stuff. So it's like, hard earned, but I know incredibly lucky because oh my God, what a wonderful gift. Like this is like people work really hard and they do not get that. So I count myself incredibly blessed and lucky. But yes, to answer your question, no, I have not had to pay for my education, but there um it's an important consideration. It was an important consideration for me like the entire time. Yeah.
right. And there was also one thing I really wanted to ask about. I'm assuming this is a day that you'll never forget, but I mean, the day that you were accepted to NYU. I was wondering if you could maybe talk about that day. I mean, how did it go? How were you feeling? I mean, it's a day that a lot of us are looking forward to. The day we get accepted to medical school, it's the goal. So, just
Yeah.
curious.
It was crazy. Was NYU my first? NYU might have been my second acceptance or third. It was like really early, and it was pretty early in the cycle. But I remember I was in lab, like working my research trainee job in the lab at Einstein, and I got a call from Dean Rivera, and I picked it up like in the lab. The service is terrible, so I'm like sitting on the windowsill with my phone like half like pressed against the window. And he was just like, pretty much like called to tell me that I was accepted to NYU. And I also was really fortunate to have received something called the Silverstein Scholarship, which covered my cost of attendance. And he told me that, and I was like, "Are you serious? Are you serious?" And he was like, "Yeah." And I was like, "Can you send this to me in an email? Like, like this doesn't sound real." I was like, I just kind of need this in writing. Like, I don't know. Like, it just I was like, this is unbelievable. Like, and for a gift, like not only to receive, because I wanted to go to NYU was always on my radar for a school I wanted to go to. So growing up, I'm from Brooklyn. Went to Hunter, obviously, and my mom, when I was in middle school, my mom had breast cancer. She was treated at NYU, and so going to visit her in the hospital and like seeing the lights of the hospital, it was just like, I was like, wow, what an amazing school, what an amazing institution. It was always something that had been on my radar. And then they had made the announcement that they were going to be free the year I was applying, and I was like, no, like it's gonna be so much harder to get in now. Like, but luckily they accepted me anyway. And it was just like to not only get that news, but to get the news that I wouldn't like that I was gonna not have debt was insane and like so unbelievable. So I went to my boss and I was like, "Oh my gosh, I got this crazy." I was like, "Can I go home?" Like, I just, like, was like, "Can I please have the day off?" And he was like, "Yes. Oh my god, get out of here, go home." I, like, was in the hallway, like, calling my mom, calling Lev, calling Charlotte, my advisor, calling Camille, like, calling my brother, like, calling like, I was it was just one of the moments I will never forget in my life. It's, like, truly, like, one of those, like, life-changing, like, things, like, you when your life just changes in an instant was that phone call for me. And I actually, like, the next day, I, like, canceled a bunch of interviews that people would never imagine canceling, like, certain names that you'd be like, "You're crazy to do that," but I was just so sure that I was like, "Hopefully, they give the spot to somebody else." I was like, "I know I'm coming here, like, this is what I'm doing." Like, what an amazing and I was sick of interviewing at that point. I was like, "If I have to go to another interview." But, it was truly one of the best moments in my life. Yeah.
Well, once again, and I know you've heard this many times before, congratulations on that.
Thank
Though it happened, I'm assuming like a while ago. I mean,
That was
still,
it was a couple years
uh,
ago.
it's still a really huge achievement though. So
Yeah.
congratulations. And I mean, you've made it through so much. You made it to getting into college, applying to medical school, getting into medical school, applying to residency, and then finally now you're in residency, you got accepted. So I mean, you've really like I mean, did this journey. So, are you excited for residency? I mean, it's really my closing question. And do you really do you want to elaborate more on your future goals as a physician?
I'm really excited for residency. I'm obviously nervous. Starting literally next week, so that's crazy. I'm really excited for the year of medicine. Like for my specialty, you can kind of choose between doing like a transitional year or doing a prelim year in medicine. I'm really glad that I ranked the prelim program in medicine first. I am just like so excited for how much I'm going to learn and like how much like what I'm going to learn this year is going to impact my patients that I have in PM&R and like when I'm like a fully practicing like a fully fledged attending. I'm really excited to, like, this year is going to be tough. Like intern year is always really tough, and so I'm embracing myself for a massive rude awakening. Considering fourth year of med school is like really chill. But I'm really excited for like all the things I'm going to learn. Like people say that you really like the bulk of your med school learning happens in your residency training, and I feel like I've learned a lot already. But I'm so excited for all the things I have like to learn, which is gonna be a wild amount of information because it takes repetition to remember all this stuff. Um, I'm really also excited to have found my career choice that I think is the right fit for me. I'm Kessler or and Rutgers was my top choice. Rehab, and so being able to go there is just like such an honor. They've got like, incredible research, like a wonderful patient population. Like they really focus on education, so I'm really excited to. Mount Sinai has this as well. Like work with the med students and like work with like aspiring physicians. Actually, Kessler's one of the only one that I know of anyway. That is, it's a mandatory rotation in PM&R for the Rutgers medical students, and so I really get to meet with a lot of people because I think like the ethos behind PM&R and like the concepts are really applicable to so many different medical fields. So it's gonna be really interesting and fun to like work with medical students who are going to like a ton of different fields. Um, but yeah, I'm really excited for what the next years are holding, like, what my future practice is gonna look like on the fields. I do see myself I'm really passionate about ultrasound, so, I definitely see myself using ultrasound in my future career. I see myself having, like, long and, like, longitudinal relationships with my patients, really getting to know them and helping them through their recovery. Yeah, just, like, having, like, nice long conversations and, like, getting helping people, like, feel empowered. I wanna be, like, a trusted source of, like, information, someone that my patients feel like they could talk to me about anything and know that I'm gonna point them in the right direction. And if I don't know the answer, I'm gonna look it up and I'm gonna get back to them and really, like, search out the literature, but also use like, expand my knowledge of, like, culinary medicine and, like, learning more about, like, lifestyle medicine and how, like, the choices we make every day impact our overall health. So that's something I'm really interested in learning more about. Also, like, integrated pain management, like, things like acupuncture I'm really fascinated by, and just, like, learning how we can apply a lot of these, uh, medicine concepts to, like, our understanding of modern medicine, and Western, specifically, medicine. But I'm really looking forward to just the chance to do like integrated medicine and learn and continue to learn for the rest of my life in ways that make people's lives better. So yeah, it's really crazy because I'm finally gonna get started on this, like being a doctor, like going in and be like, "Hey, I'm Dr. Marie, nice to meet you." But it's still like there's so many years of learning ahead before I'm like a fully functioning doctor. But I'm really pumped for this next chapter and to finally make a paycheck. Just kidding. But yeah, mostly to just, like, have a defined role, like, and just, like, work every day to improve patients' lives. So, yeah, I think I've chosen some really awesome institutions to continue my training at and hopefully figure out sure you're gonna have no choice to figure that out.
Oh, sorry, you
Mhm.
kinda, I don't know, like, a little cut off at the end.
Yeah, just, like, I'm just excited to figure it out. I don't know yet. We'll see, but there's a lot in PM&R that really sparks my interest, maybe something like pain, maybe even peds. So
Mhm.
look forward to figuring that out and maybe circling back to you in a couple of years and letting you know what I end up doing.
Yeah, I mean, it's really amazing to see how, like, at the beginning of your journey, you were kinda, like, almost unsure, like, your pre-med, unsure of, like, what your actual career is gonna be. Like, being a doctor, like, yeah, that's a career, but it's such a broad term, like, there's millions types of doctors, but getting to see now that you know what you're doing, you have the exact path of where you're going is just really, like, inspirational to see, mostly, and,
It's a long road.
yeah, it was a long road, and I mean, it kinda still will be, but I mean, but you'll get there. I mean, you've got through so much, you've gone through so many barriers, you've gone through so many, like, challenges that I don't see I feel like it'd be impossible for you to not keep going, you know? You'll definitely make it to wherever you have to go, so yeah.
Yeah, I'm excited for this next chapter. And I guess like the only other imparting wisdom that I want to like leave with is, maybe not the best ending on this note, but I'm so glad that I've decided that I want to be like a doctor and go through this entire process. There's so many other ways in which you can help people have a fulfilling career that's not being a physician. And there's so many other health careers. There's careers outside of healthcare. And so I just want to just also recognize that, like, just because you chose pre-health, it doesn't mean that you're a failure if you decide not to go be a physician and choose that particular path, because there are so many other paths. There's so many other life circumstances that may change to like what you like, or like maybe there are certain goals that don't align with that particular path. But so I think exploring your other options is not a bad thing. And part of that is just like when you're in undergrad and you're choosing the activities to do, keep an open mind, take classes and things that like pique your interest, and really like do and spend your time in ways that you're passionate about. And it may lead you down a different route, or you may continue on this route and then like this is going to be the what you end up doing. But I think it's really important to just like you're not no one's stuck. Like I feel like sometimes when you're pre-med, you're like, this is the thing I'm doing, and I've got to go all the way because I said I was gonna do this. And like it's better to take your time and reflect on like what are the things that you want. Is there something else that could fulfill those goals? And this really what I want, or is this just like what I think would be the best thing for me to do? So You like I explored other things and I still ended up picking this, but I'm glad that I took the time to explore other health careers and like consider doing something outside, like, with the policy stuff, just like thinking like, oh, well, what if I did this? Like there's so many other careers that I could do that I could end up helping people. But anyway, if you do choose to do this, use your support systems, use the people that like, there's so many people around that are there to support you at Hunter. Camille's incredible resource, the pre-health, um, the entire pre-health department is an incredible resource, but also your like classmates are a wonderful resource as well, including those who graduated. So um yeah, if anyone wants to get in contact with me, just ask Camille. She'll pass along my contact information. So, and then of course you have it as well. So if you ever have any questions about anything, feel free to reach out to me. It's really hard to do this alone, so it's important to have people there that you can rely on and that support you, like bounce ideas off of. And it's a long road, but for me, it was really worth it. And I hope that my ramblings were helpful to some of you today.
Oh, very helpful, definitely. Um, I there were a couple things I wanted to like respond. Like I wanted to thank you for bringing up how like if you want to contribute to the healthcare field, you don't just have to become a physician. It's okay if that's not the path you take. I know throughout this entire interview, you brought up a lot of other people that have both helped you on your way and that you've experienced and seen how they helped others, like social workers, researchers, um, even like dancers. Everyone plays their part in making sure that we have a healthy, society in a sense. And it's good to know that you shouldn't feel ashamed if you drop out. If you feel, you shouldn't feel less worthy, of yourself. So yeah, I mean, thank you for bringing that.
And I've seen it too. Like I know so many people right now that are so successful in careers ranging from like a lot of research to mathematics, to arts that started off pre-health and were like, this isn't the path we're gonna take. Amazing, brilliant people that were brave enough to say, I thought about doing this thing and it's not for me. And they're doing incredibly well right now. And like that is a really brave, tough thing to do. Um, and I just think that it's really important to it's a long, lifelong commitment, and it's definitely something that you should do a lot of research and a lot of soul searching before you're like, "Okay, I'm committing to this."
Right. Um, so I mean, on my end, those are all my questions. We definitely went over an hour. But I do have one very short question that I wanted to ask. In the bio you sent me, you talked about culinary medicine. I wanted to ask
Yeah.
what it is specifically. I mean, that
Yeah.
piqued my interest a lot because when I was younger, personally, I wanted to be a chef for a very long time. So I was like, what is culinary medicine? And yeah.
Yeah, so this is like it's fairly new in the medical field, but there's there's a couple. I don't know how many universities, so I don't want to say a number, but there's a good chunk of medical schools are starting to incorporate this class called culinary medicine. Each one of them looks pretty different. So I can only speak to the NYU version. So the NYU version was a collaboration between the nutrition school and like the undergraduate and graduate program and the medical school. And what it was this like 4-week long about course where you had these like lectures about like how certain foods impact your health, like things like dairy and their effect on like prostate health, for example. And of course like things like certain types of grain and how to manage your blood sugar with diabetes and like the foods and how that impacts your like blood sugar spikes. Um so like and just like plant-based foods and why they're good for you and the research behind and the data that supports like plant-based diets. So that was like the academic portion. And then there was a lab portion where we went to the undergrad and the class was headed by a professional chef who like participated in like one of those like cooking like shows. And we like made recipes, like how like plant-based recipes that just like highlighted like fresh foods like grains and like what was the thing? Swiss chard. Swiss chard is something I didn't even know like existed. And I'd obviously seen it, but I never like picked it up at the grocery store. But they showed us like how to prepare it, how to cook it, how to like chiffonade basil. Which some Italians will tell you it's it's like sacrilegious to not just like rip up basil, but I like chiffonading, and you can use it for like kale. It's just like a technique used for cutting where you like cut it in ribbons. But like
Mm,
they showed us how to prepare these dishes and how to cook them. I found out like I found like about wheat berries, which I had never heard of like wheat berries before, but it's like a type of grain that similar to almost like a quinoa or barley that like it's like a little squishy and like a little sweet. But there's just like so many like vegetables out there and grains that I had never known how to cook with or how to use. And that class kind of just was like a intro to like here's a couple of recipes that you can make. So there's so many things from that class that I like have just like incorporated into my daily life. I actually started growing Swiss chard with my husband. Like we just like to eat, and then there's like this like protein pack, like they use silken tofu. You mix it with like dark chocolate, like that you melt, and you can look it up. It's like silken tofu dark chocolate mousse recipe. And then I put some like raspberries and stuff, and like it's like amazing. It's just like you're eating tofu, but it tastes like chocolate mousse, and it's like really healthy for you. But like I had some granola on top, and like just learning to cook healthier, just like taking that class, and like learning some like basic cooking techniques, and then supplementing that with like learning techniques online have helped me feel like healthier. Obviously, eat healthier, but also learn how to talk to my patients about some of the dietary choices that they're making and like have some suggestions on how to like sneak in some more vegetables or how to like switch your morning cup of like OJ for like a smoothie, like just making certain like dietary switches that are very like actionable, easy, and like teaching people about like how certain like for example oatmeal is better than bread for sugar spikes and maintaining like your glucose throughout the day. And so, yeah, so culinary medicine is just the idea of like food is medicine, and like what we put in our bodies is just fueling our bodies, and like eating a well balanced diet is how your rest of your system kind of like stays in check. And preventative health is such a huge part. But even if you do already have certain health conditions, there's so many dietary changes and things that you can make just live the healthiest version of your life.
So, not only did NYU teach you to become a doctor, but they also taught you to become a professional chef is also one of
Yeah, professional for sure. And for no, but I definitely I gained a lot more confidence, and like it just it's more fun to experiment when you kind of have like a little bit of basis. And my mom taught me how to cook some things, of course. But I think just experimenting with new vegetables that I had never heard of before, new grains that I had never tried, and just like it encourages you to like go to the grocery store and maybe pick up something that you've never seen, like bulgur wheat, and be like, okay, bulgur wheat recipes, like how do I do this? So yeah, I think it's just yeah, it's become like a nice fun hobby for me, but also I know it's like something that's impacting my health and will hopefully help me like continue to impact patients' health as I continue on this process.
and you kind of talked about it earlier about how like nutrition is really like a large aspect of the medical like education, so I mean that's amazing to see that there's a class that kind of like was like a really nice like kind of overview
Yeah,
of
it
it.
was cool, but honestly, you don't need the class. Like, I'm glad I took it. It was awesome, but like, YouTube's an incredible resource. Like, New York Times Cooking is a great resource. Like, there's so many things that like just like go to the grocery store, find a vegetable that looks crazy, or go to the forget the grocery, go to the farmer's market. Like head to Union Square, go to the farmer's market on a weekend, and or like I think they're on Wednesdays too. But get a vegetable that looks kind of weird and funky, and you're like, I don't know how to prepare this, and look up a recipe. Like, find out the name and just pick stuff that looks good, like seasonal fresh fruits are they're good for you for a reason. They're in season, and just like find some stuff. And I just really encourage you to experiment. Maybe that could be your maybe that's a hobby you could pick back up, because you said you're thinking about being a chef. So maybe just go to the farmer's market, find some new recipes, and just like really indulging in that part of you that was clearly important to you when you were a little kid. um that might be a fun hobby, but I'll leave that up to you, and I'll circle back.
Thank you very much. All right, I'll consider that. I never even thought I never thought of that. I mean the fanciest vegetable I think I could think I can't even think of a fancy vegetable to be honest. Broccoli. I mean, I'm not sure.
No way. All right. Well, then maybe that'll be part of your homework. Go to the farmer's market and find something interesting and let me know what it is. Send me a picture, okay?
Got it.
All right. Great
So
talking to you. Any other questions?
oh no, that's all questions. It's 9 o'clock now.
Yeah,
uh
yeah, I should leave it.
so I just wanted to say thank you so much, Dr. Mazzeo Weaver. And yes, you deserve that title, so I'm gonna call you that.
Thank you so much. I say Mazzeo, but I also it's I answered anything. We also pronounce our last name wrong. It's supposed to be Mazzeo, but so yeah, I say Dr. Mazzeo Weaver. But thank you so
Yeah.
much for having me here, Isaiah.
Of course, yes, no problem. And yes, um, yeah, I mean, overall, this was an amazing interview. I know a lot of pre-med students here at Hunter are going to be watching this and are going to gain a lot of inspiration from this. So thank you so much for your responses today. So yeah.
Yeah, happy to be here. And if anyone has any questions for me or just like Camille can get us in contact. I'm always happy to help out a Hunter alum or a Hunter student. This community is so important to me. So thank you for having me. And thanks for asking such interesting questions today.
Of course. Have a wonderful day and good luck on your residency next week. Yeah,
Thank you. Good luck with the rest of this process and finding that hobby, okay?
got you. Thank you so much.
Bye.